Welcome to Medical Frontlines. I'm Yvonne.
And I'm Jack Lin. Today, we're examining a crisis that's silently threatening Taiwan's healthcare system. Emergency rooms are losing doctors at an alarming rate.
The numbers are shocking. One of Taiwan's top hospitals lost 12 emergency physicians in just 2 years, and nationwide, 72 emergency doctors abandoned their posts in 2023 alone.
Behind every resignation is a story. Why are these highly trained professionals walking away? And what happens to patients when the safety net of emergency care starts to unravel?
Jack, you recently spoke with Dr. Liu, who left her ER position after 7 years. What pushed her to make that decision?
Burnout, plain and simple. She described working 36-hour shifts and treating up to 40 patients per day. The emotional toll became unbearable, going from trauma cases to cardiac arrests without a moment to process.
I've heard similar stories. One doctor told me he hadn't had dinner with his family on a weekday in 3 years. The hospitals keep cutting corners while patient numbers climb.
And here's the kicker: many are finding better opportunities elsewhere. Private clinics offer comparable salaries without the punishing schedule. No more missed birthdays or interrupted sleep.
Those cosmetic and anti-aging clinics actively recruit ER doctors because their crisis management skills are gold. Why manage emergencies when you can manage wrinkles for better pay?
I spoke with Dr. Chen, who now runs an aesthetic clinic after 10 years in emergency medicine. He smiled for the first time in our interview when describing having weekends off.
But this exodus creates a dangerous domino effect. With fewer experienced physicians, who mentors the new generation of emergency doctors?
Exactly. Taiwan's ER residency programs are already struggling to attract talent. When I visited National Taiwan University Hospital last month, they had filled only half their positions.
The data is alarming. Taiwan's turnover rate exceeds 10%, while countries like the US maintain rates between 3 to 5%. This gap represents a system in crisis.
And patients feel it directly. Average ER wait times have increased by 40% in the past 3 years, and quality metrics are declining across the board.
I interviewed a family who waited 7 hours with their grandmother before seeing a doctor. By then, her condition had significantly worsened.
So what's the solution? When I posed this question to healthcare administrators, they mentioned piloting flexible scheduling at 3 hospitals.
That's a start, but doctors I've spoken with say the issues run deeper. They need competitive compensation, manageable patient loads, and institutional respect. Today we've uncovered why Taiwan's emergency physicians are leaving: systematic burnout, financial disincentives, and quality of life factors that private practice resolves.
The crisis is real, and the clock is ticking. Without immediate reforms, we risk the collapse of a system we all depend on in our most vulnerable moments.
We want to hear from you, especially if you work in healthcare. What solutions do you see? Share your thoughts in the comments.
Join us next week as we investigate Taiwan's nursing shortage and how it compounds these emergency care issues. Subscribe so you don't miss it.